Good afternoon and welcome everybody to this webinar all about sending campaigns and invitations for the COVID-19 vaccination from ourselves here at MyGP. My name's Daniel. Thank you very much for joining so promptly. I'm going to take you through the webinar today. Just before we do so, a few things just to tick off as we go. First of all, to let you know that you're all on mute as you've joined there. Now, don't worry about that. That's just how our webinar runs, so that you can get the most out of it today. It's not that we don't want to hear from you. We do, and we actually have a Q&A function you can use during the webinar today. My lovely colleagues Emma and Zoltan are there to answer your questions. Feel free to say hi to them if you wish. Post a question through, pop your name on it, let us know where you're from there. But we will actually have a live Q&A available at the end of the session today as well. So you will have a chance to ask your questions at the end of the session today as well. First of all, let's have a quick look then at what today is bringing us. So first of all, we have our agenda on the screen here. Now I'll go through this in a bit more detail in a moment for you, just to let you know we're obviously in the welcome and intro at the moment. So we will run through some details here, and then a little bit later I'll cover off these ones here. But there's some slides that's been going around. For those of you that have only just joined, I'd just like to take you through some of those slides because there's some very useful information on them. So first of all, did you know that iPlayOto operates a number of regional COVID-19 vaccination hubs across CCGs and STPs. So before you run a campaign, you may want to check with your CCG. For any information about centralized messaging from the MyGP Engagement Hub, you can contact them at hub@iPlayto.com. Now, as I mentioned that you're on mute at the moment, do check your sound settings there. Just make sure that you can hear us okay. We do find that you may be tempted to sort of follow along on your own MyGP Connect system whilst going through the webinar today. We would very much recommend sort of keeping your focus here so that you keep all the information to hand and get everything you need from the webinar today. As I mentioned, we do have a Q&A function, and you'll be able to see that on your screens there. If you click on Ask a Question, you'll be able to pop a question in, pop your name in there as well. Just let us know where you're from as you ask, and you'll be able to ask, as I say, our web chatters today, Emma and Zoltan, a question. But don't worry, no questions are visible until the moderator approves them. The final slides here, just some information about the MyGP app and MyGP Triage, which are services that you can also have from ourselves here at MyGP. But let's go back round, shall we? Let's go back to the beginning, because we should really have a look at what we're doing today. And that's all about sending those important information and invitations about the COVID vaccination. So as I mentioned, we're in our welcome and intro at the moment. In a second, we're going to move on to coding settings. Now, these are basic clinical codes set up in the system to code back to your patient care history if you're an EMIS user, or your patient record if you're Vision or System 1, to record the fact that you've sent a message to your patients. So we're going to have a quick look at that before we get into the main part of the session, which are our 3 steps here in order to build a campaign. The first of those, creating a group. Now, with the creating a group there, we'll look at getting a list of patients to send to, and then putting those into our group on the Connect system. So we'll look at how you do that from your clinical system and exporting that into your system here. We'll then look at the templates. Now, we have a few example templates, and I'm going to show you a few of those today. We do have a help page which will have more of those as well. But we very much encourage you to, if you do want to use the templates that you see here, to feel free to then amend them and edit them to make them work for yourself. So we'll have a look at a few templates and how they work. We'll also have a look at trigger words. Now, that's relating there to activating a campaign. So we will look at trigger words, and we will see how you can use those in relation to sending out, for example, an invitation to invite someone to receive the COVID vaccination. We will then look at how you send the message, so putting all those pieces together and sending out your health campaign. And then we'll then have a look at the Help tab. Now, the Help tab on your MyGP Connect system is always available to you. It's always sitting in that top right-hand corner. We'll see that in a moment. And there's lots of information in there that you will be able to access. So don't worry if I go over something and you think, oh no, I didn't get that note down. Don't worry, we're here for you. Your help tab is there for you. So if you want to make notes, absolutely, please do so. But there will be spaces and information for you to access after the webinar today as well. As promised, at the end, we'll have our live Q&A session as well. So we'll have 10 minutes for that at the end. And as I say, my colleagues Emma and Zoltan are around if you do want to post a question as we're going through the webinar today. But do feel free to wait until the end if you'd like to ask any questions so that you can focus on the information that's coming at you from the webinar from myself today. So fantastic, we've had a look at what we're going to do. Let's dive into the session then. So the first thing we need to do is log on to our lovely MyGP Connect system. So I'm going to move to that now. Now I'm going to log in into our demo area. So I'm using a dummy login. I'm going to click into log into my system. As I log in, we're confronted with our home summary page, the one we all know and love as we enter our system. And we can see in the top left-hand corner, it says Trainer Demo Site. Now, that will always say that for me here because this is our demo site. For yourselves, of course, you're going to see your practice name listed there. Now, just before we have a look at the coding settings, I do just want to cover off a couple of things that you see on this screen when you enter, because it's important for sending out your campaigns. Those are the two bits of information in the top left-hand corner below the word total, which is credit balance and last replication. Now, credit balance here shows 0. Now, that is because this is a demo site for ourselves. For some of you, you may also see 0. For some of you, you may see a positive figure there. And that is because credits are what we use in order to send out a message. And 1 credit equals 1 message to send. I'm going to be going through a little bit more info about that in a few steps' time. But based on how you're funded, you may see a positive number here. You may see a 0. If you're unsure how you're funded, from your CCG, or if you want to check if you're self-funded, then do contact either your CCG or our support team here at iPlato. Now, just below that, perhaps even more importantly, we have last replication. Now, I can see here that it is showing today's dates. Now, that's exactly what you want to see. Anytime you log into your Connect system, you want to see that date there. The reason for that is because it is letting you know the last time your Connect system and your clinical system synced up together. So it's letting me know that they have synced up today. So that's all good. I'm happy to proceed. If you ever see that sync there show lagging behind a date in the past, then we would ask you to contact our support team. They can be easily reached at help@iplato.com. Don't worry if you don't have a chance to write that down. My colleagues Emma and Zoltan will pop that in the chat as well for you. Okay, fantastic. Well, I've got the details here. I'm happy that those are up to date for me. So I'm just going to very quickly check my coding settings. Now, coding settings sit under the settings menu on the left-hand side here. So when I click on this, we will open up a new menu, and I am going to look at read code here. Now on this page, we have some different codes on the screen here. Now, again, this is our demo site. For your own sites, this may look a little bit differently, depending on whether you are EMIS, Vision or System 1, or indeed if you have moved to SNOMED codes. But here the principle is exactly the same. So here we have SMS out automated. So that's like an appointment reminder, sending an automated message. SMS out manual. Now that is like sending out your ad hoc messages, or like we're going to do today with a health campaign. We can see they have the same code because it is letting us know that as soon as you send a message out to your patients, that code will go back to your patient care history for EMIS or patient record for your System 1 and Vision users to update that you have sent a message to your patient. SMS in, exactly the same principle, but in reverse, because we can see it's got a slightly different code there. So when we receive a message from our patient, for example, if we ask them to reply to our message, then their patient care history or patient record will update automatically to say, you received a text from your patient. So nice and straightforward there. I'm happy that they are in the on position, so they are going to code when I send out the messages. So I'm happy to move on from there. Just to let you know, if you have moved to SNOMED codes and you see your system is still using a clinical code and you want to update, please contact our support team at help@iplato.com. It's them again, and they will help you do that. Okay, so we've checked our codes. We're happy that they are the ones that they want, and we're happy that they are in the on position. We are ready to move on. So everything we need in order to send out a health campaign today is going to be under the campaigns menu. So if we click on here, we'll have a new menu pop out, and our first step is groups. Now we see a number of examples on our page here. We can see it's laid out with group name on the left, when it was created or changed in the middle, the group type being patients, and then members equals the number of patients in those groups. Now we can see a few examples here, and we can see that we've had some activity. We may have sent out flu vaccination invites recently, so we've got a few groups already on the system there. Now that may be similar for yourselves. This might be the first time you're using our system to send out an invite. Whichever way around it is, for our new invite to send out information either about how it's going to work for the COVID vaccination, or indeed to actually invite people into the practice to receive it, the first step would always be in your clinical system. You would run a search for the patients that you would like to message, and then you would need to export that into either an Excel spreadsheet or a .csv file. Either is absolutely fine. And in true Blue Peter fashion, here is one I created earlier. So here we can see a number of details. My list is a little bit short. For yourselves, of course, it may be much longer, depending on how many people you're sending out to. Now, for our Vision and EMIS users, you just need to make sure that your spreadsheet has this column, Patient ID. So as long as you've got the ID there, we are good to go. For our System 1 users, do make sure that your spreadsheet has the NHS number. As for System 1, we will work off the NHS number for you. I'm going to use patient ID. So I've done my search, I've exported it into a spreadsheet here. I'm going to highlight and copy those patient ID numbers. Once I've got them, I'm going to minimize my spreadsheet because I've done what I needed to do, and I'm going to go straight to create group at the top here. The first thing we get to do is name our group. Now we can be nice and specific about the group that we have created. So I'm going to do so here. And of course, I've misspelled vaccination, so I will let the computer help me with that one. There we go. The group type, it's patients we're messaging, so we will leave that as patients. And I'm going to click Add Recipients. When we do so, we're going to get a new box saying Edit Group. Now, if we are creating a relatively small group, we can use the recipient search box here to look up patients by individual name. So we can search by name and bring them up there. But generally speaking, when dealing with a health campaign, we might be dealing with more patients. So we want to keep things nice and easy for ourselves. So for those of you eagle-eyed, you may have already spotted that in the bottom left here, we have a box saying patient IDs. This is what we're going to use in order to build our group. Again, System 1 users, you'll have the same box here. You just need to change that to patient NHS numbers in order for the system to accept the NHS numbers there. I'm going to leave it on patient IDs because I'm going to paste in the IDs that I copied earlier. Now, don't worry that you can't see them all there. They are there. We need to get them to this box on the right anyway, the recipients group. So I'm going to click this little arrow here. And I'm going to move my group to the right-hand side. And there we go, like magic, they have now appeared along with the patient details. Now, you may have spotted that as I clicked that, a new button appeared. And that button is Excluded. Now, I'm going to click this here, but my list is going to disappear. Now, the reason for that is that I've taken an example list of patients that I know to have mobile numbers in my system here. When you do a search in your own clinical systems, you are bound to pick up a few people who are not registered with a mobile. If that is the case, the system will show you who those people are here. Once you've seen them there, you will be able to highlight and copy the details and keep them somewhere safe if you'd like to invite them another way, as we're not going to be able to reach them by text message. Once we've done that, we can click Included and our list will return. I'm happy with my list here now, so I'm going to click Save, and we can see that that group has now been created. So my group name on the left, it was created today, and we've got 8 members in there. And there we go, we've created our group. Now, our examples here, I've only got a few members in there. You can actually have up to 6,000 in one group. But if you are going to message that many people in one go, you may want to consider the fact that you may well, off that many messages, get a few people responding, maybe calling in. So you might generate some calls into your practice. If that's the case, you may want to think about just splitting up a large group and putting them into multiple groups. So on our examples here, on our previous flu campaign, we can see that we have a couple of groups for an over 65 invite. So we had quite a few patients we wanted to message, so we created a couple of groups and split the search into those 2 groups there so that we could send them at different times. How we send them at different times, I'm going to show you towards the end when we look at sending the new message. One final tip with groups here as well, date it was created or last changed. If you need to rerun a campaign for whatever reason, you may want to just have a look here. How long ago was the group created? Is it a few weeks old now? Does it need updating? If you wanted to run a new search in your clinical system and update it, you can use the edit button here to return to our edit group box and paste in a new detail. If it's easier, you can simply delete the group and start again so that you know that you have the most up-to-date patient information in your group when you're sending. Okay, fantastic. Well, we have checked here and we can see that we have got our group created. We have it's been created today. We are ready to go with that group. So let's begin by moving now to the next step, which is the templates. We find this under campaigns and we go to templates. On the screen, we have a number of templates here. Now, again, depending on your own MyGP Connect system, you may see a few differences here. You may see a number of vaccination invites or flu invites in your system. If you're the first time using this system, you might only see 1 or 2 examples here. I've actually got a COVID information template at the top here, just for a couple of reasons before we look at creating a new template today. First of all, we can see that all templates are arranged by subject, and giving every template an individual subject can be really helpful so that you know exactly which template is supposed to go with which group when you come to send them. So having a look here, we've got a previous message that we've used on our site here saying COVID pre-invite information. I've put the practice name at the front and center of this message. Now, this is very important. We've done this as an example here so that when the message comes through, if a patient has notifications enabled, when that pops up, the practice name is the first thing the patient sees. So hopefully they're a bit more likely to click in there and then respond to the message. We then have the information itself. In this case, that the vaccination is coming and that we will be contacting them directly and that they don't have to contact us, for example. So there's a COVID information message. I'm going to have a look at adding a invitation for a vaccination shortly. You may notice that there's a similar one below for the flu, and you may have run some flu campaigns already this year. Having a look here, we can see the flu invitation as well, inviting people along and offering a trigger word here, texting back decline to refuse. Now that's really important, that word there, decline, that's what we would call a trigger word. So just like a patient can respond with the word cancel to cancel an appointment, we can enable a patient to be able to respond with a word to our health campaign. In this particular example, to decline the flu invitation specifically. Now that is just a piece of text at the moment. It won't mean anything to the system until we assign it a clinical code. And we can do the same thing for an invitation for the COVID vaccination. So without further ado, let's have a look at that. So we're going to click on Create Template at the top here. And the first thing we get to do is name our new template. Now, if you do have a template that already exists and it's similar, you could choose to file it away under the same heading. But as I mentioned, having a specific template for each message can be really helpful. So I'm going to name this a new subject, and I'm going to call it here a COVID vaccination invitation. Now, again, in true Blue Peter fashion, I have one that we have prepared earlier. So I'm going to copy that in now. Now, my template there, these range the same that you'll see on your help page with a space for your surgery. So I'm going to pop in the surgery name there. And you'll notice that there's a blank space for the number here. So I'm going to pop in the number as well. And there we go. We have our template ready for a COVID vaccination invitation. Now, you may notice here that we've got a bracketed term here saying first name to. That's what we call a mail merge. And that term there would go straight to the group that you're creating, and it would fill in that name automatically for you. If it's up to yourselves, if you'd like to use such a term, you can just say dear patient and write that in if you would prefer. We will have more information on that in the help page, as I promised at the end of the session for you. Now here we've got our trigger word. So here we've asked to text back reject to refuse. Now the reason I've got that in there is because decline is already on our flu invitation, and some of you may have already seen that with your own invitations if you've done flu invites already this year. Now any word can be a trigger word. I've picked one here that a patient can reply with, and we'll look at activating that in the next step. You'll also notice that just below here, we have a character count saying 157. Now that's really important. That's going to appear anywhere that you're writing a text message on the system, because a single text message is a maximum of 160 characters in length. Now I mentioned earlier that we use credits to send the message. One message, i.e. 160 characters or less, equals 1 credit to send. This is just under that there, so I'm happy that that would go as one message for myself here, and therefore cost the 1 credit to send to my patient. If you did need to send a longer message, your system can absolutely do that for you. It's just to be aware that as soon as you go over that limit of 160, it would then go as more than 1 credit, and therefore cost more than 1 credit to send. Sorry, it would go as more than 1 message, and therefore cost more than 1 credit to send. I'm happy with this, so I'm going to click save. And that's popped that in there, and it's put it in alphabetical order for me. So my COVID ones are at the top here. Now, I've used a trigger word here, asking people to text back reject to refuse the COVID vaccination. Again, just like the mail merge term, if that is not something that you want to use, if you don't want your patient to have that response and you just want to give them the information to call to book an appointment, then you could simply delete that text out of there. You have the edit and delete buttons on the right-hand side here, so you can always keep these or delete them as you need to. If we click on the edit button, we will see the template box opens up, and we can just go in there and we can select and delete that text as we need to. I'm going to keep the text as it is there, so I'm going to click cancel. And just going through what we've done here, we've created a new template. We've created a new trigger word that we're going to activate in the next step. We've made sure it's different from a trigger word that we happen to already have in use on the flu campaign there. I'm now going to go to the next step to activate that trigger word. So to do that, I'm going to click on campaigns, and I'm going to click on trigger words. Here we can see a few examples, and again, you may see similar on your own Connect systems. You may see some different ones depending on what you've done. Here we can see from the left to right, the campaign name is on the left. The clinical code that it's associated to is here, and the trigger word that that code is connected to is here as well. Now we can see here that our flu campaign is running because we've got a green status on our decline word. So we know that's running right now. So we know we can't use that word decline on our COVID message. So that's why we've put the word reject as a possibility for us there. Now, in order to add a trigger word to a different clinical code, we can go straight to Add New at the top there. Big friendly button right at the top as always. We click on Add New, and we just need to fill out the box accordingly here. So I'm going to say this is a COVID vaccination. The trigger word in question was reject, so I'm going to pop that in there. And we then come to the clinical code. Now again, we are fully compatible with SNOMED codes, so if you do need to update that, that is help@iplato.com. But with the clinical codes, I'm going to use an example for us to see here how this would work. We very much do suggest that you check in your clinical system exactly the code that you would like to use and then put that here. I'm going to use an example one today. Now what you can do is you can find the clinical code from your system and then copy that and paste that in here. So that's what I'm going to do now. As we put it in, we'll notice that we get the read code term. When I select that, it populates below for me. Now I'm going to select an end date. I'm going to put that a good couple of weeks in advance, all the way through to the end of December there. And I'm then going to click Save. And there we go. We can see that our new trigger word has been entered. Now it's let me do that because we have two different trigger words here. Every one of these examples, actually very nice examples there, they're all unique words. The reason for that is because you are tying in a unique read code into a unique trigger word. So you cannot use the same trigger word across two campaigns that are running at the same time. So here we've got two campaigns. They're both able to run as we have independent trigger words for the two different clinical codes. We can see that once they go past their end date, they would then go red, and that would let us know that they're no longer active, that the system would no longer code back those words. We can also see we have our old friends, the edit and delete button. So if we do need to, we can delete a trigger word. We can also edit that trigger word as well. So if I did need to edit this, if I wanted to change the word, or indeed I wanted to update the clinical code, then you can do so. The great thing with the system is it will not let you save a word that is already in use. So if we tried to use the word decline, for example, we can see that the save button is grayed out. It's not going to let me save it. It does need to be the word reject or a different word from the one that's being used. Okay, fantastic. Now, a couple of very good important points for you, top tips in relation to campaigns here. We've put an end date here of the end of December. When setting an end date, we do suggest putting a good couple of weeks or even a couple of months or longer in advance on that end date there. Now, the reason for that is even though you are likely to receive most of your responses in the first 48 to 72 hours, you do want to catch your late responders, those ones who pick up the phone, see the message, think to themselves, yes, I must respond to that, put it back in their pocket, and then 2 weeks later go, oh goodness, I never replied, and then send in your chosen trigger word. So do leave enough time for that, for those late responders as well. The great thing is you can put this as far in advance as you like. So if we click on edit again and click on the end date, we can just clicking through, we can put that through to the end of next year, the end of the year after, however far in advance we would like. Okay, fantastic. Well, I have created my group, I've created a new template, and I've activated my chosen trigger word for this campaign because I'd like to use one. So now we come to the next step, which is to put all the pieces together and send out that health campaign. To do that, we go back to campaigns on the left-hand side, and we're going to new message at the top here. Now, step one, select recipients. This is where you would also come if you wanted to send a manual message, if you're going to send a message to 1 or 2 people. And again, we could search by individual name here. So if you are wanting to look up someone just very quickly, you could just pop in the details and look up your patients individually. However, we've done the hard work already. We've got our groups in the bottom left here. Now we can see the different group names and we can see the group that we've created. So I want my group to be sent. So I select them and I move them to the right-hand side. When you do so, you will see the group appear on the recipient side and you'll see the number of recipients below. Now, for the very keen-eyed amongst you, you may spot here that the number of people in the group here is now slightly less than what we originally created in our first step. Now, the reason for that is that the system at this point is filtering out anybody who has been opted out of receiving text messages. So if there are any people who have opted out, you will see them opted out here, and so you might see a lower number. So perfectly normal to see a lower number here. I'm happy with my group here, so I'm going to click Next to take us to step 2, Create Message. Now again, if we want to simply click into the right-hand box here, we can simply type a message ourselves if we're just going to do a quick one-off message. But again, we've got our templates on the left-hand side, and I hope this is where you can see the benefit of having a subject for each individual message that we're sending. So it's nice and clear which group it is that's to receive which message. Now I've got a couple of COVID-related templates. We've got the pre-invite information, which in my example today, I've already sent because I now want to send a group the actual invitation. So we find the invitation, we select the text, you need to select the text below the header there, and we move them to the right-hand side. When we do so, we see the text here, and we see that character count again. So again, letting us know that that's under the 160 mark for one message. Now you may all notice that it does say attach surgery details to message here as well. Just to let you know, what that would do is it would add a link to the end of your text message. So those patients with smartphones, they would be able to click on that and they would be able to see some basic information about your practice, location, opening times. Now that link, it does count towards the characters of a message. So with my message here, it's 157. I am certain that when I click this, it will take me over that limit. Now I want this to go as just the one message, so I'm not going to click that. I don't need to click that today. I'm going to click Next and move to the third option, Sending Options. Now, there's a number of things we get to do on this page, always worth having a look through here. The first of those is scheduling when the message goes. We can choose to send it straight away. We might want to send it later. If we do want to send it later, maybe we need to time it so that it doesn't interfere with another campaign we're sending out, for example. We know that most of our responses are coming in the first 2 to 3 days. We might want to schedule this a bit later if a message is already gone. We can then do so. So I'm going to ask the system to send this next Tuesday. Now we also get to control the time, and this is really useful if you want to send a message because even though we're asking in this particular example for people to respond by text, you may generate some calls with your messages. So you may want to send it at a time when patients are most likely to be able to get through, for example, after your morning rush, or if you happen to know that there's a particular time of day that's best for your patients to call. So I'm going to ask it to send at 3 in the afternoon as well. We then get to add another clinical code. We can see read code here, and we can see the add button here. Now this is very important. I'm going to click on add here, and we're going to get a new box come up here. Now the reason this is important is because this time what we get to do is we get to add a code to the message that we are sending itself. So by popping a code in here, this will go back to the patient care history for your EMIS users or the patient record for your Vision and System 1 users to every patient that you're about to message. And we do that in exactly the same way. We find the code we want in our clinical system, we pop into the box here, and we paste that in. Now, when we do that, we can see that the example term is below, and I can select that and pop that in here. We also have a third box here, read code comment. Now here we can add free text. So for example, we could say sent via SMS if we need to, or sent via my GP Connect system, whatever it might be. Now again, I've used an example code here for my demo site. Please do check your own clinical system for the code that you would like to use before sending. I'm happy with the one I've entered here, so I'm going to click Save. And we then come to the final step, reply email. Now this is really important. I would like everyone to really focus on this section because reply email, it's rather good, but you do need to pay attention with this particular feature. When you send out your health campaign, the system would like to keep you apprised of patient responses. Now you're going to be able to see these responses in the Messages tab, and I'm going to show you that in just a moment. However, for any text message responses, the MyGP Connect system would like to keep you apprised of those by email. Now, the patient doesn't see the email at all. They simply reply by text, and the system will then send you an email copy of that message. To control where that message goes, we must click change, and we must do this on every campaign that we send out. So I'm going to click on change, and it's going to default to my dummy user's email at the top here. Now, when you're doing this yourself in your own system, it will default to your email. Now, that is because you are the user of the system putting that message together at that time. If you would like that to go somewhere else, then you would click on custom email list, and we will add in the email in the box below. Now, that could be a generic one for the practice. And then once we've created that, we click on the little plus button to make sure that email is in the custom email list box below. Once that's in there, that's where the replies will go to for this particular campaign only. So I'm now going to click save, and that's done. Okay, I have set everything up. I have checked my group, I've checked my template, and I've checked when I'm going to be sending the message. I am now ready to send out this message. So I'm going to click on confirm to send. Here we have the message confirmation summary. Now, this is a really important place to just take a pause and just double check your information, because you may be doing what we've done today. You may have started with a whole new group. You may have had to create a whole new template as well. So you have a chance to just double check everything we see on the screen here. So we can see the message itself. We can see the number of characters and the estimated number of messages that are going. Now, where it says credits, current credit, and then credit after sending, again, with my demo site here, we can see it says 0 and then a minus figure. If you are funded by your CCG, but you are funded in a way where they pay after the messages have been sent, you may see that here, so don't be surprised by that. If you are funded with credits beforehand, then you've got a positive number here. If you see a minus number underneath, then at that point, click cancel and double check with our either support team or your iPlato account manager or your CCG directly about topping up your credits to make sure that you can send your messages. We then got the delivery date here, so that's what I set, so I'm happy with that. That's picked up perfectly. And we can see the default code that we saw right back at the beginning of the session. So my default code is there, and my custom code is there, along with my free text information as well. We then have the reply email that we just entered, so make sure that's showing so that you know that your replies are going to the correct email address. And we can then do this as well. We can send a copy of this message confirmation summary to that reply email. That's a great way just to keep a record of all the messages that you're sending out to your patients, and you can maybe create a folder for those in your email and file any responses that come back with that one as well. It's up to yourselves. I am happy with my message here, so I'm going to click send. The system will let me know it's sending that. I'm happy to click OK. And it takes me back to step 1, select recipient. So if I do have other groups that I then want to send, I can then begin that process again and then schedule the next messages to go out. And there we go. That is building and sending your health campaign. So we've had a look at that there. Once that message has gone, it's going to go to our messages box. So we've got a couple of examples to show here. If I go to the menu options on the left-hand side, we can see the messages tab here. So I'm going to click on messages, and we can see inbox, outbox, sent box, arranged very much like an email, but it's just for messages. Now, when we send our message, when we send in advance, we'll see that first of all in the outbox. So if I click into outbox here, just going to refresh my screen, we can see multiple recipients. So there's my message. That's what I've been looking to send. And that's due to go on the 22nd of December. Now, the great thing is, with any messages in these outbox, as long as it's up to an hour beforehand, you would have the ability to edit the message or to delete it. Now, if you do want to do that, do make sure, as I say, it is up to an hour before the message is due to send. Once it's gone, it would leave the outbox and it will end up in the sent box for you. So there's some other examples of sent messages here from our system. But once the message has gone, it will end up in here for you. Any responses that you get, you will find those in the inbox. So if I go into inbox here, we can see a number of different messages that we'll be able to have a look at. It's just taking a moment for it to load for me here. But we'll be able to see those messages in here, and here they are. So we can see a number of different responses. We can see some declines from a previous flu campaign. We can also see an example of what reject looks like as well. So we can see that Mr. Dent here is clearly not happy, doesn't like agreeing to these things. He sent decline. He's also sent reject there. So that's where you can see those responses as well. This would also become an email then that will then go back to the email that we set a moment ago. Now, that's everything in terms of building and sending out a health campaign via SMS. Now, when we had a look at the campaigns menu there, you may have spotted, the very eagle-eyed amongst you, that when I clicked on campaigns, we've looked at every menu option here except one, call recall. Now, this is a brilliant feature and works in conjunction with practices where you have enabled the MyGP app. Now, if you have enabled the MyGP app, you could send out a call recall message. And what you can do is target your MyGP users, because what you can do is send them the invitation. You could still use a trigger word if you wanted to code in a trigger word to reject a vaccination, for example. But you could then allow your patients to book their COVID vaccination through the MyGP app. To do this, we click on Call Recall. I've got a number of examples again in my demo site. If you've used this feature before, you might see some here. If you haven't, it'll be blank. I'm going to go straight to Add New. And we can see we come to select campaign recipients. Now, this is arranged just like our edit group box from earlier. So returning to my spreadsheet, let's use NHS numbers as though we were system 1 now. We export our search from our clinical system. We get the NHS numbers or the patient IDs if you're Vision or System 1. We select the relevant button here, and we paste in what we've copied. And just like we did for the editing group box earlier, move them to the right-hand side. We then have a new button here, Export Excluded Patients. If anybody doesn't have a mobile, you'll be able to export the excluded patients here. Once we've put our group into here, we can then create a message. And here is where it gets clever. And we've got a few options here. Now we can see 2 boxes, data message on the left, SMS message on the right. Now, this is because when we send out our message, we can target people who are using the MyGP app. Now, in the group that you're messaging, not everybody might be using the app, so you can send a text message as well. I've got a couple of examples, so I'll be able to bring those up for you. So if someone's using the MyGP app, you can ask them to call to book your appointment directly through the app or to text back reject to refuse. So they have the ability to do that directly. If they're not using the MyGP app, you can create a customized message for your non-MyGP patients, and they get the text message as normal. But they could also choose to download the app in order to avail themselves of this possibility. My templates here use surgery name there, as we can see, so you'd obviously fill that in accordingly. And again, do feel free to amend and edit these templates as much as you would like to make it work for yourselves at your practice. Once we've selected our messages, we can then select the slot type we would like to invite our patients to. Now, what you will see here is a mirror of the slots available on your clinical system. Here we've got some dummy ones from our dummy site. You may want to use one that you already have. You may have created a slot type for your COVID vaccination specifically. If you have done so and you've got the appointments available in there, we can choose that slot here. You'll be able to see that here. I'm going to use my flu one as an example, because what I can do is once I've selected it, I can rename it. Now, renaming it here will not change anything in your clinical system at all. It will simply allow the patient, when they see it in the MyGP app, to see what's written here. So when this pops up in the app, when they receive this campaign, they will see COVID vaccination. We then just need to select when this button is going to be available in the MyGP app. Now, I want this to be available quite quickly, so I would like it to be available from tomorrow. And I'm going to have that available for a week. Now, the really clever thing is, this button is only going to appear in the MyGP app for those patients that you are sending to. So it's only going to appear for any patient that has the MyGP app in the group that you've sent to. It doesn't appear for any other user. Once you've selected the slot and you've given it its window to appear in the MyGP app, we can select the scheduled send time. Now, this is going to be available from tomorrow, so I would like that message to be sent from tomorrow, and it'll go at 12 o'clock. Now, I'm happy for it to do that. Just be aware that the button will appear first thing on the day that you select here. So my button's going to appear in the morning. I'm going to send the message a bit later, and the patient will be able to pop in and see that that button is now available. Just like before, a patient can also, yourselves at your practices, you can also add a sending code again. So just as we did a moment ago, we click on add, we pop in our code, and we can even do the comment again as well. Once we've done that, we would click confirm to send, and we would get the same message we saw before. We get to double check our work before sending. I'm not sending this one today, that was just an example, so I'm going to click cancel there. And I'm just going to return us to our home summary page. And there we go, that was Call Recall as well for you. Now, just before we enter the Q&A, I know you may be dying to ask a few questions, but I do want to show you the Help tab, I did promise. So in the top right-hand corner here, we can see the Help button. I'm going to click on that Help button here. And that's taking me through to our main Help page. Now, there's lots of information that can be really helpful on here. Specifically in relation to today's session, I would very much urge you to have a look at this one here, the seasonal flu campaign, because even though it's called seasonal flu rather than COVID message as we have done today, everything in here is applicable to what we've done. So if we will click in here, we will go through to the seasonal flu help page, and we will see a number of things in here, including preparation, what to do before we begin going into our Connect system, including some example templates there as well. Do feel free to use those, but as I mentioned, do feel free to amend and edit to your heart's content, make it work for yourselves at your practice. We've also got variable field examples. So thinking back to that first name too, that's in a variable field. There's examples in there that you can use for campaign messages if you would like to. We then have our step-by-step guide, including everything we've gone through today. So creating a group, creating a template, activating a trigger word, and then sending out that campaign. Now, we covered Call Recall there at the end. If you do want to go through in more depth, we even have that information here for you as well. And once you've sent your invite, there is a post-invite checklist, which can be helpful for you as well. So do feel free to avail yourself of that as much as you would like. If you do ever need them, you can always contact our support team. There's a link at the bottom of this page here. There's also a link on the main help page as well. So if you do need them, you can come into here. You'll find their email address in here. Again, that's help@iplato.com. But you will also, if you need them, find their telephone number in here if you do want to get them on the phone directly. And that is everything that I wanted to take you through today. So I do appreciate everyone's attendance and patience. I love taking you through that today. I'm now going to hand over to my colleague Emma, who is going to go through any questions that we might have had during the session there. I know you might have asked a few as we've been going, but we've reached our Q&A, so I'd love to go through a few of those questions. Emma's going to take you through those now. So Emma, over to yourself.
Thank you so much, Daniel. That was brilliant. Thank you so much for covering all that information. Yeah, you are right. We have had a very busy chat Q&A today, and we've had some brilliant questions coming through from our practices. The Q&A is open, so please feel free to ask me any questions that you had on the session that we've done today. But I do appreciate you're very, very busy people. If you don't have any time for the Q&A, you can always email us at training@iplato.com. That's training@iplato.com. And we can answer your questions there. We will be sending everybody a follow-up email as well, so you'll have our email address there, and we'll put a link to our help site for you too. Some great questions have come about saying that, oh, will you actually have a recording of this webinar? Well, yes, we will, but you do need to give us a couple of days because we do like to kind of polish up things just before we publish it on our help site. So once it is published, I will send you out all a link to say it is ready for you to go. But if you cannot wait, if you really want to get invitations out, Dan has already showed you how you can access our help page from your MyGP Connect system, and he's going to do that as well now for you. Thank you for being such a lovely assistant. And we've been covering lots of things on flu invites as well. So you actually can go into our seasonal flu campaign, and it literally covers the exact same information that we've gone through today, but just with flu as your invite. That's the great thing about your MyGP Connect system. It doesn't matter what type of campaign you're going to send out. It's following the same steps. You just change the title of what you're going to be sending to your patients. That is it. You just follow the same steps. Thank you so much, Dan, for showing. So you can see there we've got step-by-step examples for each little thing as well. And I'm just waiting for any questions to come through. We've had other questions about, are you compatible with the SNOMED codes? And I can confirm that we are compatible with SNOMED when it comes with IMIS and TPP, but you do need to contact our support team first. If you contact them, they can move you over and update your system for you. We've had some other questions about, oh, could you provide me the correct clinical codes for sending out a COVID vaccination? Unfortunately, we are not able to here at iPlato. Any codes we've used today are purely example codes, just for the training benefits. We do recommend that you go into your clinical system, which is my understanding you do have a library of your codes there, or you can contact your PCN as well if you do want some further details on sending out the messages, codes to use, and any processes that you need to put into your practice. I'm skimming like so far. I think, Dan, you've done a pretty good job with your training today, because I'm seeing like tumbleweeds in the chat at the moment. No questions coming through from our practices. So if we have provided everything to you for today, please feel free to jump off. I know it's lunch o'clock for a lot of people, and also after having all this information, I'm sure you're ready for your next cup of tea or coffee. Thank you so much for joining us. If you do want to recap, if you want any of your other colleagues to join, we are holding another session on Friday. I believe that one is at, I want to say it's at 11:30, but I'm just going to double check. No, it's a little bit earlier at 10:30. My apologies. So 10:30, we have another one of these webinars, and then we have got another one on Tuesday 22nd, and that's the one that is going to be on at 11:30. So, oh, I can see we've got a question through, so I'm just going to have a look. Oh, someone's asked if we have any templates around COVID vaccinations. Currently, we do not. We've just given example we do just have example templates in our system. So, Dan, if you could just jump to the help site for me, please. And Dan can show you where we've got some sample templates for flu vaccinations, which would have very similar wording that we used today. You could copy and paste that, and then you could adapt it with any guidelines that you have been provided. As we are obviously very new times with everything going on with vaccinations, we do try to update our help materials as quickly as we can, and we'll see if we can do anything in the future for you. But we do have example templates on our website. That's an absolutely brilliant question. Thank you so much for that. I've just published it for the rest of our attendees to see. And I'll just go back to see if there's any other, maybe any other questions that came through during our session today. I think we might have covered them all off. I think it was mainly about SNOMED codes, clinical codes in general, and recording so far. So please do not be shy. If you do have any questions, we do not see any, no question is too small, too big. If we can answer it, we're definitely going to do that today. If not, we will always find the answer for you and get back in touch. I do appreciate sometimes everyone, you're a little bit shy. If you're shy, do not worry. Please just email us at training@iplato.com. You'll either hear from Daniel, Zoltan, or myself, and we can get back in contact with you. Also, if you feel that you do want any kind of repeat training on your iPlato system, please also you can give us a request through as well. We do have some slots available next week, just in the run-up before the Christmas holidays. But as I'm seeing that some people are starting to leave, I think we've definitely increased some people's hunger. They're ready to go off and have their lunch. So please feel free to hang around, ask some more questions if you have them. If you are happy, please go. Please go about your day. Kath from Bay Medical, hello. Nice to have you finally on a webinar. I know it's been a long time coming. Brilliant to have you here. I hope you found it useful. Lovely to hear from you. Sorry, there's not favoritism for Kath and Bay Medical, but she is one of our practices we do speak to quite a lot to give her support, and she's been very helpful with the system, so it's lovely to have you. The practices here at iPlato Healthcare, you're the thing that makes everything worthwhile. So we love to hear from you. We love talking to you, and we really appreciate you joining our webinar today. We really do hope you found it useful. If you have found it useful, it would be lovely to hear some feedback about the session as well. So what I'm just going to do is I'm going to just add a feedback link in for you. If you do feel that you have a spare couple of minutes, it'd be lovely to hear how you feel the webinar went, if there's anything we can do to improve your service to you as well. So we're coming to the last couple of minutes of the webinar. So if you do have any questions, this is definitely the time to pop them in the chat. If not, we'd just like to again say thank you so much for joining. We hope you join us again for another webinar in the future. And or you can always pop us an email if you'd like to ask us a more private question, and we can get in touch. I also would like to thank Dan as well for his training today. Thank you for going everything over for us today, and always in such a clear tone and showing us the system and how it works. You always help me remind me a few things about the system too. So we're just coming back down to our last minute of the webinar. So I think if there is no more questions, I'm going to keep an eye on our Q&A tab. But if there's no further questions, thank you so much for joining. And I'm just going to hand back to Dan just so he can also wrap up as well for you. Over to you, Dan.
Thank you very much, Emma, and thank you everybody for your questions. That was lovely. Thank you so much indeed. Always good to have everybody engaging with us here today on the webinar. I've had a great time being able to go through the information with you. Just to recap, the help page, it's there in the top right hand corner of your Connect system. Click on that anytime you need it. It's always there. And as Emma mentioned, we're no more than an email away if you need us. Thank you ever so much to everybody who has been attending. It's been wonderful to have you all here. Otherwise, we're now going to draw the session towards a close. So do go about your day. It's definitely lunch o'clock, as Emma said. I'll leave the session open for one more minute, just in case anyone does have a question. But otherwise, thank you very much indeed from all of us here at MyGP, and have a very good rest of your Wednesday.